Welcome back to the deep dive.
where we dig into the sources to pull out the key insights for you.
Exactly. And today, it's a topic that really hits home for everyone, isn't it? This desire we all have, not just to live longer, but to live well for longer.
Yeah, that idea of health span.
Right, your health span, that time you're actually feeling good, you're healthy, free from those chronic diseases, the disabilities that can creep up with aging.
hmm And look, there's just so much information out there, especially about nutritional supplements. It can be overwhelming.
Totally confusing sometimes.
Right. So our mission today is to cut through that noise. We're looking really closely at a big review paper on supplements for healthy aging.
And what's cool is it takes this multi-domain approach.
Yeah, it's not just one single thing.
Exactly. So we're pulling out the evidence-backed stuff on everything from muscle health to sleep, brain function, even hearing and vision.
We want to help you understand what actually seems to make a difference for age-related conditions based on the science and, what might just be hype.
All right, let's get into it. Where should we start?
Let's start with something really foundational. Keeping your muscle power as you age. We need to talk about sarcopenia.
Sarcopenia. Okay, it sounds kind of technical, but it's basically muscle loss, right?
Exactly. Age-related loss of your skeletal muscle mass and strength. And the thing is, it starts way earlier than most people realize.
Like not just when you're old.
No, it can actually begin creeping in during your 30s.
Wow, okay. That's surprising.
It is, and it's pretty common, affecting maybe up to nearly 30% of older adults living in the community. But here's the kicker.
Uh-oh.
After age 50, your muscle mass can drop by about 2% every single year.
2% a year.
Yeah. And your strength. That can go down by about 15% every decade after 50.
Whoa, okay, so if you're not actively working against it, you're losing ground pretty fast.
You really are. And this isn't just about, looking less fit. It directly impacts your ability to move, your independence, and unfortunately, it increases your risk of falls quite significantly.
It is a huge issue for older adults.
Absolutely huge.
Yeah.
And that's why protein intake becomes so critical as we age.
Right, we hear about protein all the time.
But older adults, they actually need more protein than we used to recommend. That old RDA, the recommended daily allowance, of 0.8 grams per kilogram of body weight per day,
Yeah.
it's likely just not enough for older people trying to fight off sarcopenia.
Okay, so what should people be aiming for?
Well, groups like the POTH study group and European nutrition societies, they recommend more like 1.0 to 1.5 grams per kilogram per day.
That's a pretty big jump. Does it actually make a difference in real life?
The data suggests it really does. There was one big study looking at thousands of people. It found that adults over 60 who ate more than that 1.0 gram per kilo of protein daily had a 22% lower chance of functional disability.
22% lower risk. That's significant for staying independent.
It really is. And here's another interesting layer. It's not just how much protein, but when you eat it.
The timing matters too.
It seems to, yeah. Spreading your protein intake out across the day seems to be better for muscle building and retention.
So not just one giant protein shake after a workout.
Probably not the best strategy for older adults, no. The research suggests aiming for about 0.4 grams per kilo per meal.
Okay.
Ideally hitting that 3, maybe 4 times a day. That gets you into that total range of 1.2 to 1.6 grams per kilo daily. And it seems to maximize muscle protein synthesis better.
Got it. Spread it out. Now, really important point here, a caveat for our listeners.
Yes, absolutely critical.
If you have pre-existing kidney disease, this higher level of protein might actually be harmful.
That's right. It could be deleterious. So always talk to your doctor before making big changes to your protein intake, especially if you have kidney issues.
Definitely. And what about where the protein comes from, plant versus animal? Does that matter much?
It's a bit nuanced. Generally, the amount of protein seems to be more important than the source for muscle. But there's some suggestion that plant-based protein might be better if you already have risk factors like obesity or heart disease.
Right.
Whereas animal protein might be linked to lower all-cause mortality if you don't have those pre-existing risks. So it's not entirely clear-cut.
Interesting. Okay, let's shift to supplements specifically for muscle. This is where things often get hyped up.
They do. But one supplement stands out with really strong evidence for muscle health and aging. Creatine.
Creatine.
Wow.
We hear a lot about that in the fitness world. Does it really work for older adults?
Yes. Decades of research show it significantly increases muscle mass, strength, and function in older adults,
Okay.
especially when you combine it with resistance training.
That combination seems key, doesn't it?
Absolutely essential. You need the stimulus from the exercise. Creatine helps potentiate those effects.
Can you give us an example? Like, what kind of results are we talking about?
Sure. One study with men aged 50 to 71, they did supervised resistance training. The group taking creatine saw their leg press strength increase by an average of 30 kilograms more than the placebo group.
30 kilos, that's huge.
Yeah, and their chest press went up by 14 kilos more.
Wow. That translates to real-world strength, like carrying groceries, getting up from a chair.
Exactly. Real functional improvements. The typical dose used in these studies is often 5 grams per day or sometimes a bit more.
Okay, 5 grams. Now, safety. We have to talk safety.
Yes, very important. Creatine is generally considered safe for healthy adults. No major issues for kidneys in healthy people despite old myths,
No.
but it is not recommended for individuals with cancer. There are some potential pro- or anti-tumor effects that aren't fully understood.
Right. Avoid if you have cancer.
And as we touched on with protein, if you have pre-existing kidney disease, you absolutely need to consult with your nephrologist, your kidney specialist, before considering creatine.
Got it. So healthy adults are generally fine, but cancer or kidney disease, definite doctor consultation needed.
Precisely. Non-negotiable.
Okay. What about vitamin D? We hear so much about vitamin D deficiency.
Yeah, and it is important. Vitamin D supplementation can help improve functional outcomes, but mainly if you're actually deficient to begin with.
So if your levels are already good, taking
Yeah.
extra might not do much for muscle.
That seems to be the case based on current evidence. Correcting a deficiency, usually defined as levels below, say, 20 or 30 ng/ml, is beneficial. Beyond that, the added benefit for muscle specifically isn't clear.
But it might help with other things, like falls.
Yes, potentially. It might reduce fall risk, which could be linked to better muscle function, but also potentially bone strength and even some cognitive aspects. So getting your levels checked and correcting deficiency is still important.
Makes sense. And omega-3s, often promoted for anti-inflammatory effects. Do they help muscles?
Despite their role in reducing inflammation, the current research does not really support using omega-3 supplements specifically to prevent sarcopenia.
Huh. Okay, so the inflammation link doesn't translate directly to muscle preservation here.
It appears not, based on what we know now.
All right, what about BCAAs? Branched chain amino acids. Super popular.
Yeah, very popular. Generally speaking, if you're getting enough good quality protein spread throughout your day, you probably don't need extra BCAAs for muscle growth or strength.
But isn't one of them, leucine, really important?
Leucine is key, yes. It's the main trigger, the rate-limiting amino acid for muscle protein synthesis. Getting around 3 grams of leucine per meal might help increase lean body mass.
Okay.
But here's the thing. You usually get enough leucine from whole food protein sources like whey, casein, soy, beef. And those whole foods often lead to a better overall anabolic response than just taking isolated BCAAs.
So food first, generally?
Generally, yes.
Okay.
However, there are specific situations where BCAAs can be helpful for older adults.
Like what?
If someone has certain chronic conditions, maybe liver disease, or if they're on glucocorticoids for rheumatic conditions, or if they already have sarcopenia and their metabolic needs are really high.
Okay.
In those cases, supplementing with 4 to 12 grams of BCAAs daily can be effective, helping to meet those increased demands.
Got it. So specific clinical scenarios, not necessarily for everyone.
Exactly. And speaking of protein types, for older adults, specifically with sarcopenia trying to boost muscle synthesis,
Yes.
whey protein seems to have an edge over casein,
Why is that?
mainly because whey has higher concentrations of that key amino acid, leucine, and it's digested faster, leading to a quicker spike in amino acids in the blood.
Okay, good practical tip there. So wrapping up on muscle, what's the big takeaway?
The absolute biggest takeaway is that no supplement works in a vacuum. Resistance training, actually working your muscles against resistance, is the single most powerful thing you can do.
It's the foundation.
It is the foundation. Supplements like creatine can help. They can potentiate the benefits of that exercise, but they don't replace it. They're allies, not magic bullets.
Excellent point. All right, from strong muscles, let's pivot to something equally vital for quality of life. Good sleep.
Yes. Because honestly, what good is living longer if you're just exhausted all the time?
So true. And insomnia is a huge problem for older adults, isn't it?
It really is. Affects maybe up to almost half of older adults. We're talking difficulty falling asleep, staying asleep, waking up too early, feeling unrested.
Yeah, that daytime fatigue.
Exactly. And it has to be happening fairly often, like 3 times a week for over a month, and actually impairing your day. Plus, Sleep naturally gets a bit less efficient as we age anyway.
And it's not just about feeling tired, right? It links to other health problems.
Oh, definitely. Chronic pain, cancer outcomes, heart disease, depression, even cognitive function. Poor sleep impacts all of them.
Okay, so what about supplements? Can anything help? Though I know the official stance is cautious.
Right. It's crucial to state up front. The American Academy of Sleep Medicine doesn't actually recommend any specific dietary supplement for treating chronic insomnia.
Okay, that's important context. But people still look for options. Melatonin is probably the most common one.
It is. And we know our natural melatonin production tends to decline with age.
So supplementing seems logical. What does the evidence say?
Well, the evidence is okay, but not stellar. Studies are often small or not perfectly designed. But among the over-the-counter options, melatonin probably has the best evidence, particularly for older adults. It seems to help improve sleep efficiency, meaning more time in bed, actually asleep, and reduce nighttime awakenings.
Does it help you fall asleep faster?
Interestingly, not significantly according to the reviews.
Yeah.
It doesn't seem to shorten sleep latency much.
And dosing?
It varies. Tiny doses, like 0.3 milligrams, are sometimes used for shifting your body clock, like with jet lag. For sleep onset issues, doses are often around 3 milligrams. Safety seems pretty good in the short term.
There's a big but coming, isn't there?
There is. A huge one.
Yeah.
Melatonin supplements are classified as dietary supplements, which means they are not tightly regulated by the FDA like medications are.
What does that mean in practice?
It means the quality control can be, well, alarming.
Yeah.
One study tested various melatonin products.
All right.
The actual amount of melatonin ranged from 83% less than the label said to almost 480% more.
Whoa, that's wildly inconsistent.
It's shocking. And get this, over a quarter of the supplements tested also contain serotonin.
Serotonin, isn't that a controlled substance, a neurotransmitter?
Yes. It shouldn't be an over-the-counter supplement. That's a major quality and safety concern.
Okay, that's genuinely scary. So, the advice?
If you do consider melatonin, use the absolute lowest dose that works for you, and probably only for short periods. Long-term studies are lacking, and given the quality issues, caution is definitely warranted.
Wow, good to know. What else do people try for sleep? Magnesium.
Magnesium comes up. The research is still pretty early, mostly low-quality evidence.
How is it supposed to work?
It plays a role in regulating brain activity, acting on both excitatory systems, like NMDA receptors, and inhibitory ones, like GABA receptors. Kind of helps balance things out.
Any studies showing it helps?
One study gave older adults 500 milligrams of magnesium oxide for 8 weeks. They reported feeling like their sleep was better efficiency, falling asleep faster, waking up less.
Subjectively better.
Right. But the objective measures, like from sleep tracking devices, didn't actually show significant changes. So maybe a perceived benefit, but the hard data isn't quite there yet.
Okay. And valerian root, that's an old herbal remedy.
It is. It has a long history of use. But unfortunately, the current scientific evidence is really inconsistent. Most reviews conclude it just doesn't reliably support a positive impact on sleep.
So tradition doesn't equal evidence here.
Not in this case.
Yeah.
And interestingly, some reports suggest that high doses, like 1,800 milligrams, might actually increase anxiety in some people.
Totally opposite effect.
Yeah. Plus, like melatonin, the quality and consistency of valerian supplements can be a real issue. The active compounds can vary a lot.
Okay, so maybe not the best bet. Are there any natural foods that show promise?
Yes, a couple of interesting ones with some early promising research.
Like what?
Kiwi fruit.
Kiwi fruit. Really?
Yeah. One small study had people eat 2 kiwis about an hour before bed for 4 weeks. They reported improvements in falling asleep faster and sleeping more efficiently. Kiwis are rich in antioxidants and, interestingly, contain some serotonin.
Huh. Who knew? What else?
Tart cherry juice.
Ah, I've heard about that one.
Some small pilot studies suggest that drinking about 240 millimil, like a cup of tart cherry juice, twice a day helped older adults.
How?
It seemed to increase their melatonin levels naturally, reduce some markers of inflammation, and again improve their subjective reports of sleep quality after just 2 weeks.
Interesting. Does it matter if it's concentrate?
The study suggested that fresh or frozen juice might be more effective than concentrate, potentially because of processing effects on the beneficial compounds.
And that inflammation link is interesting too.
Yeah, it ties into the bigger picture idea that overall diet quality, particularly reducing inflammation through diet, can impact sleep.
Fascinating. Okay, from sleep, let's move on to sharpening our mind's brain health.
Yes, cognitive function.
Yeah.
This is obviously a huge concern as we age.
Absolutely. That fear of cognitive decline from mild forgetfulness, what they call mild cognitive impairment or MCI, all the way to Alzheimer's disease. It's the leading cause of disability worldwide.
It is. And here's something that might surprise you. The physical changes in the brain, like atrophy or shrinkage, can actually start as early as our fourth decade.
In our 30s, already.
Yeah, so thinking about prevention early on is really key.
Okay, so what does nutrition offer here? Any vitamins or minerals that stand out?
Well, deficiencies in magnesium and vitamin D are pretty common in older adults, and they might play a role. Low magnesium or hypomagnesemia has been linked to Alzheimer's risk.
And vitamin D.
The evidence for vitamin D is a bit more robust than for magnesium currently. Some studies suggest that supplementing with around 800 IU per day for a year improved cognitive function in people who already had MCI or early Alzheimer's,
How might it be working?
possibly by reducing inflammation in the brain or maybe affecting telomere length, which relates to cellular aging. The research on magnesium is still described as burgeoning, meaning it's growing, but still early days.
Got it. What about B vitamins? B6, B12, folate? They come up a lot for brain health too.
They're really important. One key reason is their role in lowering homocysteine levels in the blood.
Homocysteine.
Yeah, it's an amino acid. And high levels are linked to an increased risk of Alzheimer's, maybe contributing to 12% to even 31% of cases.
Wow, that's substantial.
It is. And B vitamins, particularly folate, B6, and B12, help break down homocysteine. Plus, older adults are more prone to B12 deficiency specifically, because absorption can decrease with age.
So does supplementing help cognition?
A large meta-analysis from 2022, looking at 95 studies, found that yes, B vitamin supplementation did improve cognitive performance after about 12 months.
But
The effect seemed stronger in people who were in the earlier stages before they had established MCI or Alzheimer's. Once the condition was more advanced, the benefit was weaker.
so again, early intervention might be more effective.
It seems that way, yes.
Okay, let's talk about anti-inflammatory approaches. Omega-3s again, and the Mediterranean diet.
Right, omega-3 supplements for cognition. The evidence is actually pretty mixed overall.
Really? Because we hear so much about fish oil for the brain.
We do. And eating fish regularly is associated with slower cognitive decline in observational studies.
But the supplements might not be the same.
It's possible. Many supplements use a processed form, ethyl esters, which might not cross the blood-brain barrier as easily as the forms found naturally in fish. It raises that question.
Is it the fish or the whole lifestyle?
Exactly. Is it the omega-3s in the fish? Or is it that people who eat fish regularly also tend to have other healthy habits? We can't be totally sure from the supplement trials alone.
Makes sense. What about the Mediterranean diet? That seems to have stronger backing.
Oh, absolutely. The evidence for the Mediterranean diet is really strong and consistent. High adherence is linked to something like a 33% lower risk of developing MCI or Alzheimer's.
33% lower risk? That's huge.
It's very significant. And this finding has been replicated in many studies. Now, again, you could ask,
Is it just the food?
right, or is it the whole Mediterranean lifestyle package? The diet, plus maybe more physical activity, social engagement, that kind of thing. It's likely a combination, but the diet pattern itself is clearly a major factor.
A powerful dietary strategy then.
Yeah,
And creatine. Does our muscle builder help the brain too?
potentially. The brain uses a lot of energy, and creatine plays a role in energy recycling within cells, including brain cells.
So the idea is more energy for brain function.
That's the theory. Research is ongoing. Some studies show benefits, especially when the brain is under stress, like during lack of oxygen or sleep deprivation. But overall, the evidence for cognitive enhancement in healthy, rested people is still conflicting. We need more research to figure out optimal dosing and effects for the brain.
And the same safety caveats apply.
Absolutely. The warnings about cancer and kidney disease still stand. Always check with your doctor.
Okay. From the brain, let's move to another crucial sense. Hearing.
Yes, age-related hearing loss, or presbycusis. It's incredibly common.
How common?
Affects roughly 2/3, so the majority,
Yeah.
of people over 70. It's the most common sensory deficit in older adults.
And the impact goes beyond just not hearing well, right?
Profoundly so. It really impairs social interaction,
Mm-hmm.
can lead to isolation, affects safety, and this is critical. It significantly accelerates cognitive decline.
Wow. How strong is that link?
Even mild hearing loss is linked to nearly double the risk of developing dementia. Severe hearing loss, over 5 times the risk.
5 times. Okay, protecting hearing is clearly vital for brain health too. Are there any supplements that might help?
It's an area with less research than, say, muscle or cognition, but there are a couple of leads. One is alpha-lipoic acid, ALA.
An antioxidant.
Yes. Animal studies show pretty robust proof that ALA can help reduce age-related hearing loss.
What about in humans?
Human studies are much more limited. There's some suggestion it might protect against noise-induced damage and maybe reduce tinnitus symptoms, but it's very early days. It needs much more research.
Okay, promising but preliminary. Anything else?
Folate, another B vitamin.
Folate again. It seems to pop up everywhere.
It does seem important for nerve health generally. Studies have observed an inverse relationship, meaning lower folate levels are associated with a higher risk of hearing loss.
So keeping folate levels up might be protective.
That's the idea. The research suggests aiming for good folate status, reflected by erythrocyte folate levels around 658 nmol, which might correspond to an intake above 600 micrograms per day.
Interesting. But other antioxidants might not help here.
Yeah, interestingly, one study actually found that supplementing with vitamin C and E was correlated with a higher risk of hearing loss.
Higher. That's counterintuitive.
It is. It really highlights that we can't just assume all antioxidants are beneficial for everything. We need specific evidence for specific conditions.
Absolutely. Okay, last but definitely not least, let's talk about eye health. Preserving our vision.
Crucial for quality of life. And eye diseases like macular degeneration, cataracts, and glaucoma are major contributors to disability in older age.
Let's start with age-related macular degeneration, ARMD. What helps there?
This is actually one area where specific nutritional supplementation has really strong evidence, thanks to the AREDS studies.
AREDS.
The age-related eye disease studies, huge, well-conducted trials. ARMD involves damage to the macula, the central part of the retina, and oxidative stress is thought to be a key factor.
So antioxidants should help.
Exactly. The original AREDS trial tested a formula with high doses of vitamin C, vitamin E, beta-carotene, zinc, and copper.
Yeah.
It found this combination reduced the risk of progressing to advanced ARMD by about 25% in people who already had intermediate ARMD.
25% reduction is pretty good.
That was a landmark finding. But then they did AREDS too.
What changed in AREDS too?
They tweaked the formula. They tested adding lutein and zeaxanthin. Those are carotenoids found in leafy greens, egg yolks, colorful fruits.
Right, good for eye health.
Yes. They filter harmful blue light and act as antioxidants in the macula. Adding lutein and zeaxanthin resulted in an additional 10% reduction in the risk of progression to advanced RMD on top of the original benefit.
Wow, even better.
Yeah. And crucially, they also removed beta-carotene from the formula in AREDS 2.
Why remove it?
Because the original AREDS study found that beta-carotene increased the risk of lung cancer, specifically in people who smoked.
Oh, okay. Important safety update.
Very important. So the AREDS 2 formulation with vitamin C, E, zinc, copper, lutein, and zeaxanthin is now the standard recommendation for people with moderate ARMD to slow progression.
That's clear evidence-based advice. Did omega-3s help in AREDS too?
They tested adding omega-3s, EPA and DHA as well, but they didn't find any additional benefits specifically for ARMD in that trial.
Okay. What about cataracts, the clouding of the lens? Do antioxidants help prevent that?
Unfortunately, no. Despite lots of studies looking at vitamin C, E, beta-carotene, lutein, zeaxanthin, none have shown a significant effect on preventing cataracts, slowing their progression, or reducing the need for cataract surgery.
So supplements don't seem to be the answer for cataract?
Doesn't look like it, based on the current evidence.
And glaucoma, that's damage to the optic nerve.
Yes, a progressive neurodegenerative disease. Here, the most promising supplement evidence points towards vitamin B3, also known as nicotinamide or niacinamide.
B3, how might that help?
Nicotinamide is a precursor to NAD+. NAD+ is a really crucial molecule for cellular energy metabolism and resilience. Its levels tend to decline with age and in conditions like glaucoma.
So boosting NAD+ might protect the optic nerve cells.
That's the thinking. Low NAD+ levels have been observed in glaucoma patients. Animal studies are promising, showing neuroprotection. Some early human trials suggest short-term improvements in retinal function with high-dose nicotinamide.
But is it ready for prime time? Should people take it?
Not yet. The evidence isn't strong enough for a routine recommendation. We need larger, longer-term human trials to confirm the benefits and safety. But it's definitely an exciting area of research for glaucoma neuroprotection.
Okay, so lots of ground covered there. As we wrap up this deep dive, what's the overarching message, the big picture?
I think the biggest picture is that healthy aging is incredibly complex. It's multifactorial. There's no single magic bullet. A holistic approach is definitely key.
Right. It's not just about popping pills.
Not at all. We've seen some supplements do have strong evidence for specific conditions like creatine for muscle, the AREDS2 formula for macular degeneration, maybe B vitamins for early cognitive support.
Yeah.
But many others have limited or inconsistent evidence or maybe only help if you're deficient, like vitamin D.
And it was interesting how some things, like maybe magnesium or focusing on an anti-inflammatory diet, could potentially offer benefits across different areas, like sleep and brain health.
Exactly. It highlights the interconnectedness. The goal here is to provide you, the listener, with a solid foundation based on the evidence.
So you can have more informed conversations with your doctor.
Precisely. This isn't medical advice, but it's information to help you ask better questions and work with your healthcare provider to tailor strategies that make sense for you.
Because the best approach really seems to combine those foundational lifestyle things, good nutrition from food, that crucial resistance training we talked about.
Absolutely. Diet and exercise first.
Yeah.
Then you can strategically add targeted supplements where the science is strong and it's appropriate for your individual situation.
Build the foundation, then add the evidence-based extras. Makes sense. So a final thought for people to chew on.
Well, as you think about navigating this world of healthy aging, maybe consider this. What if the most powerful supplement isn't actually something you buy in a bottle? What if it's the cumulative effect of all those consistent, informed choices you make every day about your diet, your movement, your sleep, seeing each day, each choice as an investment in your future health span?